My name is Gretchen, and I'm doing my medical terminology project on cerebrovascular accidents, most commonly known as a stroke. Cerebro, meaning the brain, and vascular, meaning blood vessels supplying it, is a cerebrovascular accident, or CVA as it is known in medical terms. A stroke is a neurological deficit caused by impairment in perfusion to the brain. The key word here is perfusion, which pertains to the circulation of blood and delivery of oxygen and nutrients to the brain. A stroke is the equivalent of a heart attack, but to the brain, a brain attack. It is a sudden death of brain cells due to it being starved of oxygen and nutrients, which is caused by blockage of blood flow or rupture of a vessel to the brain. The brain starts to malfunction, severely causing damage to different parts and functions of the body. Abilities controlled by the affected area of the brain, such as memory and muscle control, can be lost. Some basic physiology. The brain is an extremely complex organ that controls various body functions. Blood supplies oxygen and nutrients. If a stroke occurs and blood flow cannot reach the region that controls a particular body function, that part of the body won't work as it should. If a stroke occurs towards the back of the brain, for instance, it's likely that some disability involving vision will result. The effects of a stroke depend on several factors, including the location of the obstruction and how much brain tissue is affected. However, because one side of the brain controls the opposite side of the body, a stroke affecting one side will result in neurological complications on the side of the body it affects. For example, if the stroke occurs in the brain's right side, the left side of the body and the left side of the face, hence it drooping, will be affected. Now we can move on to 3 different ways a stroke can happen. First is an ischemic stroke. Ischemia means an inadequate blood supply to an organ or part of the body. In this case, the inadequate blood supply to the brain is caused by a clot. It's the most common type of stroke as it makes up 87% of all stroke cases. Arterial occlusion, occlusion meaning blockage of a vessel, leads to hypoperfusion. Hypoperfusion meaning below the normal amount of circulation. In other words, because an artery is blocked or even narrowed, perhaps because of a plaque buildup either within the brain or elsewhere within the body, a section of the brain is then not receiving adequate blood supply needed to function normally. Dying brain tissue can be salvaged if reperfused in time. You can survive from this type of stroke. But a more deadly type of stroke is a hemorrhagic stroke. It is less common. Here, the stroke can be caused by an aneurysm, or an enlarged blood vessel caused by a weak artery wall, which then ruptures and leaks. This spills into the surrounding brain tissue and splits white matter fibers. This causes swelling and pressure, causing more damage. Underlying issues that can result in a hemorrhage is hypertension or high blood pressure and aging blood vessels. Here you can see an ischemic stroke compared to a hemorrhagic stroke. On the left, you see a grayed out section of the brain caused by a clot that forms earlier in the brain's blood vessel pathway. That grayed out section represents the brain being deprived of all the oxygen and nutrients it needs. And then compared to a hemorrhagic stroke, you can see that the blood does reach that area of the brain, except a weakened artery wall causes a massive spillage or a leakage of blood into the surrounding brain tissue, which is much more deadlier and much more irreversible. Transient ischemic attacks, or TIAs, are known as mini-strokes. Whereas a stroke results from a rapid onset of brain function lasting more than 24 hours or leading to death, TIAs resolve within 24 hours. An artery is temporarily blocked and temporarily reduces function. Since this doesn't cause permanent damage, it might seem like no big deal, but ignoring it is a big mistake. Signs and symptoms. Use the letters in FAST, F-A-S-T, to spot stroke signs and know when to call 911. Face drooping. Does one side of the face droop or is it numb? Ask the person to smile. Is the person's smile uneven or lopsided? Arm weakness. Is one arm weak or numb? Ask the person to raise both arms with their eyes closed. Does one arm drift downward? Speech difficulty. Is their speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a simple sentence like, "The sky is blue." Is the person able to correctly repeat those words? Time to call 911. If somebody shows any of these symptoms, even if the symptoms go away, call 911 and say, "I think this is a stroke," to help get the person to the hospital immediately. Time is very important. Don't delay, and also note the time when the first symptoms appeared. Emergency responders will want to know. The important thing to remember here is to recognize signs and symptoms and respond by calling 911. Stroke warrants the same degree of emergency as a heart attack. Time is brain.